Thank you everyone for joining us today. We are in for a great presentation and I'm going to get started by introducing you. Oops, sorry. I'm going to get started by introducing you to Leah Groppo. She's a diabetes educator and senior clinical dietitian in Stanford's Endocrinology Clinic and diabetes care program. Leah has experience in counseling patients on how to achieve their health goals, interpret pump and CGM data, focus on customized diabetes management. At Stanford, she teaches diabetes education classes, conducts one-on-one appointments, teaches fellows and medical students, and mentors interns. Leah is a board certified in advanced diabetes management, and she has a passion for growing food and loves to garden with her family. So we are going to get started with Leah going to present her slides right now.
Great. Thank you so much, Elaine. That was a great introduction. Hello, everybody. It's nice to meet you. Today, we're going to talk about carbohydrate counting. And so I wanted to kind of start off and really share that there are seasons for all different types of tools within education, right? And if you feel like this is a great season for you around carb counting, you think this might kind of help you to think about portions, perhaps your dosing, maybe what type of your insulin based on food, that might be a great option as well. But I wanted to give you some kind of foundations to really, what are my thoughts when I'm teaching carbohydrate counting? What are maybe some of the exceptions? So maybe we do carbohydrate count and our blood sugars are still higher than we would wish. What might be going on there? And really kind of, hopefully by the end, you all will be on your way to being diabetes educators. So today we're really going to talk a lot about foods, some strategies to kind of think about, things that I've picked up along the way with meeting with lots of different people, things people have taught me, and hopefully pass it on to you. So why do we want to carb count? So a lot of people will carbohydrate count because they're dosing insulin. And so mealtime insulin oftentimes will have, there will be a carb ratio. So depending on how many grams of carbohydrate we consume, we dose the insulin based on that. But some people perhaps are not dosing insulin. And maybe we want to look at carbohydrate counting for portions. So carbohydrate counting can kind of help us to understand what portions we're having, and if that's kind of fitting in line with maybe where our recommendations are. And then just thinking about, maybe you can put in the chat and I can monitor that. Why else would we want a carbohydrate count? Why did you decide to come to this class today around carbohydrate counting? You can put it in the chat. And I can definitely read them out as we go. What other reasons, like, would you want to know how to carbohydrate count? What are people thinking? I can also leave the chat up, and if people want to add maybe their whys as we go, definitely feel free.
Yeah, we're getting some responses right now, and so for one person's responding back, just to also carb count for their partners to better help manage the food intake, I think, with your partners.
Yeah, excellent. So maybe in a caregiver role, maybe not just for ourselves. So excellent. And so I always want to go over, before I really get into my 3 steps for carb counting, what is food made of? So food is made of things that are delicious. It's also made of macronutrients, which are basically our large nutrients, which are carbs, fats, and proteins. And then it's also kind of these smaller nutrients, micronutrients like vitamins and minerals. So these are kind of the scientific things that food is made of. But then, of course, like flavors and textures and taste, all those great things that make us enjoy food. But I think for this talk, it's kind of important to go over that. And then in general, what do we recommend? So we kind of recommend these different ranges for meals, maybe around 30 to 60 grams of carbohydrate for most adults, snacks 0 to 30 grams for people living with prediabetes or diabetes. Say you're training for a 5K walk. Maybe you're exercising more and you're doing 30 to 45 minutes of exercise 5 days a week. Potentially for some of those meals, you might want to eat more or less. It really is dependent on your goals. And so this is a question I want to start off with, and we'll hopefully answer it by the end of this session. But what are carb grams the whole picture? So if we're just looking at counting carbohydrates, are we going to be able to very meaningfully predict what our post-meal blood sugar is? And so hopefully at the end, we'll kind of understand how to answer this question a little bit more. So are carb grams the whole picture? I also want to talk a little bit about fiber. Fiber is something that I really love to talk about because it helps us to kind of answer that question. Is it only about the grams? So when we think about what are carbohydrates, we think about starches, we think about fiber, and we think about sugar. So carbohydrates are that big umbrella that those different types of things fall under. So things like fiber is metabolized and broken down in your gut. It doesn't go into your bloodstream. So fiber isn't something that makes as notable effect on your blood sugar. It can also really help with heart health, regulating the carbs that you do consume, and blood sugar regulation, can help reduce inflammation, improve gut health. If you want to know really a lot more detail about that, Elaine did a talk last month that has been posted on gut health, and may help with cancer prevention. There are two main sources of fiber. There's soluble fiber, which is fiber that dissolves in water, kind of forms a gel. It helps you with delayed gastric emptying. It really increases the time it takes to move through the digestive tract. It helps with lipid lowering and decreased glucose absorption. So if we have a food like beans or lentils, for example, a really high fiber food that has a lot of soluble fiber, research shows that we don't absorb all of the starches. Some of the fiber kind of binds up and helps us to excrete some of those. And then thinking about insoluble fibers, the other type of fiber, so things like bran, more like those scrubber brushes in our colon, they really help with elimination. They're in a lot of peels, different things are also in beans and lentils. So getting into kind of how do we carb count? So I always think about this kind of in a step. I like ABC, 1, 2, 3, all those things. So step one, we want to really identify what are the carb foods on our plate. So if we're thinking about, let's kind of start the carb counting process, or we're going out to a restaurant. Let's think about what are the foods that actually have carbohydrates and what foods don't. So we're kind of separating and isolating that. Foods that contain carbohydrates are things like starches, different grains, potatoes, peas, corn, all the things that I'm listing here. And something I'd really like to talk about is just because a food contains carbs, we've gone through this kind of generation where people say carbohydrates are the enemy. But coming back to what do carbohydrates do for our bodies? Carbohydrates give our body energy, gives our brain energy to lets us think, gives our muscles energy. But sometimes we can get into a little bit more of an issue when we have a mismatch. So we get lots of energy from carbohydrates. Our bodies break them down into glucose, and that's the energy form in our body. But when we eat more carbohydrates than our body, muscles, brain need, it can build up in our bloodstream. Also, sometimes because something called insulin resistance, maybe our cells are resistant to absorbing more of that sugar. And so it's running a little bit higher in our body, which is more what we think around type 2 diabetes and pre-diabetes. So carbohydrates, I will say, are not the enemy, but we do want to be thoughtful around the portions that we consume, and how we kind of craft our meals to really help give our bodies the best type of energy. But these are foods that contain carbohydrates. So oftentimes people will look at this, or I'll talk to people and they'll say, oh, does that mean I can't ever have bread anymore? Or I can't have peas or corn? Absolutely not. It doesn't mean that. But we do want to isolate and think about these are the foods that will increase the grams of carbohydrate. We want to just count them. Step two, we want to figure out the portions of the carbohydrates that we're consuming. So some of the ways that we can do this are eyeballing estimation, using like our hands as and like fist size as kind of somewhere to a ballpark place to look at, using measuring cups. Some people even like to use a scale. I always think that as if we can make things easier is always better. But perhaps you want to do an experiment and you're really not sure how many carbohydrates you're consuming. You could always say, hey, for these 3 meals, I'm going to measure what my carbohydrates are and put them on my plate and see what that looks like. So if I were to measure out some lentils and beans, what does half a cup of rice and 1 cup of lentils look like? What does a cup of pasta look like on my plates? Because we have all different types of sizes of plates, and that can make a difference. And then you have a more informed eyeball estimation. So those are things that I would kind of recommend. But I think if you're pulling out a scale every time you go to eat, that kind of makes eating a little bit less fun. And I don't think we would get a lot of benefit from that. But if you want to pull a scale out maybe for a couple of days and really kind of get an eyeball, that can be helpful. If you're weighing foods by a scale, something that I do like to talk to people about is the weight of the food includes the water in the food, the protein, the fat, and the carbs. So if you weigh food and you just take that gram, that's not going to be the isolated carb gram. That's going to be the gram of the whole product. So just something to be mindful of. There are some scales that will say, put in the type of food, and then it will give you the gram of carb for that food. For example, like if you weigh strawberries, it will say this many grams of strawberries is what you've placed on the scale, and this many carbs. I don't think people need to get that granular. Something I really love is our hands go with us when we go out to eat, when we're around, and thinking about for most people, a fist size is about a serving of carbohydrates. It's about a cup. For some people, it's a little bit less. I'm not a very tall person. My hand is probably 2/3 of a cup, but you can kind of look down now and say, like, what does my fist look like? And perhaps that's a good portion for carbohydrates for at a meal or with a snack. So that could be anywhere between like 30 and 45 grams of carbohydrate for like pasta or rice, depending on your fist size. We have some other ideas like fingertips servings of fats. I also really kind of like the palm size. If you make your palm kind of look like this is like your serving of nuts that you can kind of put in. And then always the times that we can increase our non-starchy veg intake or produce intake. I'd say like 2 fist size or an open hand. We want to think about as much of that as possible. And then step 3, this is part that the first 2 steps really build into, but we want to figure out the amount of grams of carbohydrates in that food product. And so there are a lot of different ways we can go about doing this. We can read labels. Oftentimes foods don't have label. Maybe we're cooking at home. Maybe we're grabbing an apple for a snack, something like that. Those don't have nutrition fact labels. So it doesn't apply to everything. If we're eating out at a large restaurant, a chain restaurant, oftentimes they have nutrition facts. And so that can also kind of help to dictate understanding the carb grams. And then thinking about going back to kind of those fist size. So if you're eating out and you're thinking about the portion of pasta, maybe go to a place that has big portions of pasta. Thinking about like what is a fist size or maybe a fist and a half size of pasta. And then for your hunger, what else can you fill into that? So a fist or a fist and a half of pasta, I don't expect that to be something to fill people up, but there are so many other options. If we think about what type of salad or non-starchy veg can we add, proteins, things like that. We don't have to try to get our bodies full just eating carbohydrates. Because carbohydrates, our bodies are very effective at turning them into glucose and digesting carbohydrates, which can be really helpful when we need energy. But it's not the food we just want to eat isolated to help fill our stomachs because we'll be hungry in a couple hours. So we do want to balance out with more fiber, veggies, and protein. So sometimes a lot of people say, well, I make all my meals at home. I would go back to step 1 and think about what are the foods you're putting on your plate that have carbohydrates, and then really think about kind of those portions. So if you make a mixed meal, say you make a soup and then you throw some pasta and potatoes in your soup with veggies, sort of think about what portion of my soup bowl is those starches, and you can kind of place that into a cup size or a fist size and try to go from there. There are also some apps like MyFitnessPal that's free. We want to look for those green check marks because they are more helpful. Thinking about sometimes people use this another free app, Calorie King. There is one called Figwe. I do like the Figwe app because it actually shows you a picture of what the food you're choosing is. So if you say, I'm having 30 grams of carbohydrate from bananas or apples, for example, it actually has them cut up on a plate and you can look at it, eyeball, and say, yeah, that looks right, or that doesn't. Because I would say I've been a dietitian for a long time and still sometimes thinking about the weight of a food because I really grew up more in the cups and volume base. Like I love to bake and do things like that. Can be really hard for me to make that switch. So I would say the Figme app is really helpful if you're like, I'm not sure if it's a cup or not a cup. You can always pull that app out and it will show you a picture and you can compare. And then some people like to use this app called Carb Manager. It's been recommended by some of my patients, but it is one that's paid. I always go free first, and then if you really love a product or want an alternative, something else they offer, pay for it, but trying to not add more costs. This is something that's also free, the Food Data Central. So this is put out through the US Department of Ag, and it has pretty much all foods. Most of the apps like MyFitnessPal pull a lot of the foods from here. The only problem is it's a really hard to search and kind of more arduous place to go, but it's highly accurate. So if say there's a food that you've been eating and it has been frustrating because you're carb counting it, and thinking it's going to work and your blood sugars are always higher than you would expect, this would be a great option to go and really see, hey, is the app really giving me the correct carb gram, or is something kind of off? It's very accurate. So looking into nutrition fact labels, I teach a lot of diabetes classes and we always talk about who looks at labels. And so nutrition fact labels are a really nice map for us to look at and kind of understand, but we need to know, as with all maps, like what we're actually looking at. So I would say when I look at a nutrition fact label, I always start at the top. We think about the servings per container and serving size, because this really helps us to understand how much of the product is all of the other information geared towards. For example, say I'm really hungry and I want more than a cup of this product, and say I want 2 cups, right? Like 2 fists. I would have to multiply the carbohydrates by 2. So it'd be 68 carbohydrates, not 34. And so thinking around how do we look at nutrition fact labels and how do we make a really good, realistic assessment of what we plan to eat? So sometimes I'll go through and say, oh, I'm only going to have like half a cup of this popcorn, right? But once I start munching, it's easily 4 cups. So really trying to get honest and say, how much am I actually going to eat when you're thinking about carb counting, and not having a judgment around that. So thinking about that, and then you can look at calories if you really want to. And then down here, I always look at total carbohydrates for carbohydrate counting. Total carbohydrates, it's really interesting. It's never going to add up. Dietary fiber and sugars will not add to total carbohydrates. Total carbohydrates includes the fiber, the sugar, and the starches, but it doesn't pull starches out on a nutrition fact label. So if you've ever wondered why the total carbs never match up, it's because they're not adding those starches onto that label. Something that we put on the nutrition fact label in the last, like, I think 5 years or so are added sugars. Something else to think about. So when we think about total sugar, that word total, that includes all the sugar in that product for that, in this example, 1 cup. And that's 0. But added sugars don't add on to total sugars. So if the added sugars were 5, the total sugars would not end up being 11. It would still be 6. But 5 of the 6 would be added. I hope that makes sense. I think that on the nutrition fact label, if you look at the total carbs, total sugar, you really don't have to do more math. And so that's something I always think about. And then if you're looking at percentages, this is based on a 2,000 calorie diet. Some people eat more than that. Some people eat less than that. Everybody has different needs. So 5% or less is lower in that product, and 20% or more is considered high in that product. So things you might want to be lower, like saturated fats, sodium you might want to be lower, fiber you may want to be higher. So it just depends on kind of what you're looking for. This is something I just pulled off of, I think, a large chain. And just thinking about when we're going to different restaurants and thinking about our carb count, this is a place that makes burritos. We can really think about maybe pre-planning and say, what would it look like if I got X? So in this example, this is a burrito with a tortilla. It has some chicken in it, and it also has some veggies and different things. And so in the end, the carbohydrates ended up being 130 grams of carbohydrate. And so if we look at that and we go, oh, 130 grams is probably more than what my body needs in this moment, we can go through and maybe make it a bowl or think about adding more lettuce and make it more of a salad and put chicken and veggies and beans on the salad instead of having the tortilla. But in the end, when we're thinking about carbohydrate counting and portions, it really depends on what you want to do, right? So if you really love your burrito and it's 130 carbs, maybe you have a half of it and eat the other half later. Maybe you still decide to eat the whole burrito, but just knowing that you have lots of different options. And I think education is really powerful. If we eat burritos, maybe in this example, 130 grams of carbohydrate, more carbs than our body needs at that one time. And we always see our blood sugars are 100 points higher than we wish or higher than we'd like, then it can help maybe think about if we eat burritos consistently, maybe we want to think about how to add more veggies or kind of alter the macronutrient change. And then just really thinking also, fruit is great, but thinking about the type and the size of the fruit can definitely make a big difference on carbohydrate counting. This is more if you're dosing based on insulin and carbohydrate counting, and then giving yourself mealtime insulin. If you're just looking more for portions, I would just say enjoy whichever apple comes your way, the bigger apple or the smaller apple. But if a 4-ounce apple is about 15 carbs, 4-ounce apples are actually really hard to find. They're very small. Most apples are about 28 grams of carbohydrate, a really good source of insoluble and soluble fiber, though. This is something that I think is really, really interesting. So kind of going back to that initial question I talked about, do we only look at carbohydrate grams? Is this the only thing that really influences what our blood sugars do? And I think as we're kind of making the case, we're thinking perhaps maybe not. There are other influencers around not just grams of carbohydrate. Maybe it's how much of it is fiber. Maybe it's also how we process the food. So if we think about eating a wheat berry salad, so wheat berries, we boil them, and then we eat that as in our salad versus taking those wheat berries, milling them, turning them into fine flour. That fine flour version is going to raise our blood sugar a little bit higher faster than the whole wheat berry version, even if the grams of carbohydrates are the same, so the portion is the same. So we want to think about trying to get our foods as close to Mother Nature made them as possible. So looking down at our plate and saying, oh, that's some lentils, or on my plate, I have some veggies and some tofu or chicken. We want to try to keep it as close to Mother Nature as possible. So a little bit less processed, less milled if we're looking at blood sugar and what's going to raise our blood sugar a little bit higher faster. Another example might be whole fruit. So eating a fruit salad versus having blended fruit as a smoothie. It can get a little bit more tricky because sometimes smoothies, we add Greek yogurt or more protein, and that can, of course, affect how food is digested. So adding some Greek yogurt to a smoothie can slow the rise of blood sugar, even if the grams of carbohydrate are the same. Um, and then thinking about just the fiber content. So are we having 40 grams of rice or 40 grams of lentils? Well, 40 grams of lentils would raise our blood sugar less because a lot of those grams are fiber, and fiber doesn't really raise our blood sugar. And then how ripe is something? So if we think about a banana, for example, like a very green banana, kind of hard, a little bit astringent when we eat it, has a little bit more bite versus a banana that's very ripe, very yellow, maybe some brown spots on it, very sweet. The banana hasn't taken carbs from the air. It's just taken what carbs it has in the banana and converted them to more readily available sugars in bananas, for example, from resistant starches. So resistant starches, our bodies don't have the enzymes to break down, so they will not raise our blood sugar. Versus when we think about a more ripe banana, the banana has gone through the process of ripening and we're more able to absorb the sugar in that banana. It's not to say you can't have a ripe banana at all. This is just kind of laying out some background. And it's not to say you can't have flour at all. Of course, I would never say that. It's just thinking about if there's a food that's been raising your sugar higher than you would have expected, perhaps you can go back to this kind of list of 7 and think about it. The fat content of different foods, like I mentioned, like in a smoothie, like Greek yogurt, which is protein, in fat-free Greek yogurt. There's also full-fat Greek yogurt that had protein and fat. Can also kind of slow down the absorption of those carbohydrates. I always think about when you eat food, your stomach has to kind of churn and digest, and it's going to have to weed through more macronutrients, fats and proteins, than if it just gets put carbs in. There was a pizza study done in Italy, and so they actually looked at fermented dough. So taking that pizza dough and letting it ferment, and pizza dough that was fermented for greater than 24 hours did have a little bit lower glycemic effect on people's blood sugar, same people. But really thinking about the fermentation process, it depends on how processed the carbohydrate is. So going up to number 1, and then also how long is the fermentation. I was talking to someone the other day and they were making a batter and letting it kind of ferment for 5 hours. And it was really not yielding the blood sugar that person was expecting, because a 5 to 6 hour fermentation, it's still not really as able to make that same impact greater than like a 24-hour plus fermentation. So you do want to look for a longer. And then temperature. So I think this is so interesting. And I've really seen this over and over. So temperature, hotter foods that are warmer, can absorb a little bit faster versus cold foods. So that can also really affect blood sugar. So if you're wondering, you're eating maybe 20 grams of carbohydrate from some hot chocolate, but it is immediately raising your blood sugar, maybe higher and faster than you would have expected. You could try that experiment, maybe make cold chocolate and use the same amount of grams. It may affect your blood sugar a little bit different, all in the name of science. So these are just some of the kind of foundations to think about what is affecting our blood sugar other than just the carbohydrate grams. And there's a lot of things that can affect our blood sugar. It's really how our bodies utilize and digest foods. So thinking about if we carb count and we say we're dosing insulin based on our carbohydrates, or we're just really kind of trying to stick to 30 to 45 grams of carbohydrate, why is our blood sugar potentially still very variable? So like I kind of mentioned on the other slide, fat and protein can really affect our blood sugar. What else we're eating? Are we even putting carbohydrates in first? So if we're eating a meal and we're really hungry and we dive into our rice on our plate as our first thing we start eating, that can also affect our blood sugar versus if maybe we're diving into protein or non-starch veg. The digestion time can help affect our blood sugar. So if we're eating higher fat foods, like for example, maybe like a pizza, like a combination pizza, that's going to hang around in our body and take longer to digest. And we'll have the capability of raising our blood sugar for a little bit longer. If you're taking insulin, when you give your insulin, when you take your insulin in relationship to when you eat, are you giving the insulin a little bit of lead time, maybe 20 minutes? Are you putting insulin into your body at first bite or maybe at the end of your meal? That's going to make a big difference. really as well. And then, of course, your activity. So we know that going back to the insulin resistance, so when our cells are more resistant to absorbing glucose, oftentimes, because once we fill our cells and our cells have enough glucose to convert to energy, our cells know that they're kind of at capacity. So they don't really need more sugar until it gets utilized. So when we exercise, especially strength-based exercise, our cells then say, oh, like we're deficient in glucose, we need more. So it actually takes this receptor called GLUT4, and it goes and travels to the membrane, and it helps us to be more sensitized to our insulin and to allow more glucose into the cell, because now the cell says, oh, we use the sugar we had that we converted into energy, ATP, and now what we're going to do is go out and try to find more. Because once sugar enters into the cells, like the muscle cells, for example, it needs to be used there and converted into energy. So it doesn't ever get re-released back into the bloodstream. So activity really helps us to reduce our insulin resistance by really telling those muscle cells and different cells that, oh no, you actually do need more sugar to uptake. And so that's one of the reasons too, we'll see lower blood sugars, sometimes up to 24 hours lower on days that we're more active. Just some other things to consider. This is something that I really like. So thinking about processed foods, I mentioned trying to eat foods as close to Mother Nature made them as possible. In this picture, there's kind of wheat berries in the back with that spoon versus flour versus bread, like fermented sourdough bread, and then processed foods. So thinking, if we were to look at corn, for example, like an ear of corn, we can all say that is an ear of corn. But then if we keep going down and we say, is that cornmeal? Yes or no? Perhaps it could be some other type of yellow grain-based thing. So we're not 100% sure. Maybe it's like millets or something like that. And then going down to corn flakes, that could be made of a lot of different types of grains, and then high fructose corn syrup. So the more processed we get, I always think about whoever's processing the foods, like the food companies, are the ones that are doing the digestion that we want our mouth and our body to do. So we want to try to eat foods as close to Mother Nature made them as possible. This is something for people who are using insulin. So really thinking about, when do we give our insulin? So are we giving our insulin 20 minutes before we eat and put carbohydrates in our body? Or are we giving it after? Or are we giving it at the start of meal? So the 20-minute pre is that red line in this graph. And really what this is showing us, that with the same amount of insulin, based on what we're eating, we really have a lot lower blood sugar than when we're giving insulin at the start of meal or even the post of the meal, because our bodies are actually starting to break down carbohydrates and turn it into glucose in our mouth. We have enzymes in our mouth that will help to kind of break that down. If you don't believe me, you can always take a piece of air pop popcorn without salt or butter on it, and you can stick it on your tongue and kind of like suck on it for maybe 10 minutes, and it will start tasting sweet, actually, because your enzymes in your mouth is going to start to break down those carbohydrates and turn them into glucose in your mouth. And so really the digestion of carbohydrates, our bodies, because they do use that as a primary source of fuel, are very good at utilizing carbohydrates. So if we're giving insulin, that 20-minute pre-bolus for most foods really kind of helps. I know there's a lot of potential barriers to that. It can be really challenging, eating out different things, but trying to get 20-minute pre-bolus can be helpful. It can really help blunt the blood sugar spikes because insulin definitely does need time to really absorb. So I wanted to talk about some of the carbohydrate counting challenges. So this is something that I really learned. So carbohydrate counting challenge is pasta. Because like we mentioned, looking at nutrition fact labels can be really helpful. But nutrition fact labels for pasta use dry weight, right? And so when we're thinking about dry weight for pasta, we normally carbohydrate count as prepared. Does anyone have any ideas of why why the food companies might list pasta dry and not cooked? If we don't eat dry pasta, we eat cooked pasta. Why do you all think we might do that? You can put in the chat. When we think about pasta, for example, the reason why the food companies put the pasta dry is everyone cooks their pasta to different hydration levels. So some people might overhydrate. Oh, somebody said trick to eating more. I don't know, perhaps. Normally it's in ounces. And so it's really hard to visualize an ounce or 2 ounces of serving. But maybe it makes it a little bit more tricky. Thanks for answering. Um, Also thinking about the hydration. Oh, Elaine, did you have something?
No, I was gonna look at the chat box, but you answered that one.
Oh yeah, I'm yeah trying to monitor everything. Um, so thinking about pasta because the hydration is going to change the volume of the pasta. So if you think about making rotini pasta or like a macaroni pasta and you overcook the pasta, the little pasta shells and are gonna kind of squish on each other and not really have as much air, and there will be more pasta weight per cup of portion. So that's like one of the main reasons why they do pasta dry. But it can get really tricky, right? If you're carb counting and you're like 2 ounces of pasta, what does that look like? 42 grams of carb. There's just like a lot more, makes it more mystifying, I would say. So thinking about a 1 ounce of dry pasta, it's about half a cup. It depends on how you cook your pasta, but if you cook your pasta al dente with a little bit of bite, then it's about half a cup. So in general, 2 cups of pasta is about 1 cup of pasta. Different pastas have different volumes, so some will be a little bit different, like pasta with more air, for example. So if there's a big, like a I'm blanking on the different names, so many types of pasta, but if there's a lot of air within the pasta, like a macaroni or something like that, that's going to sort of displace some of the grams of carbohydrate versus like an angel hair pasta, for example. And then when we're thinking about carbohydrate counting, we always think about as prepared. So we carb count basically as prepared as we're going. And so really thinking about when we're reading labels and say we see that kind of 2 ounce example in our brain, we can think probably about a cup of pasta. So we want to think about serving size. If we're only going to eat a cup of pasta, 42 grams of carb. But if we plan to eat more than 1 cup of pasta, then we have to also add that additional. And then just thinking about like on this left side or my left side, this is the dry pasta. And then this is that same pasta, same portion as prepared. So 2 ounces and then about a cup cooked. But oftentimes we see pasta or we're served pasta as a meal, right? So we're not really getting to see just the isolated pasta. Same with like the soup example I had given earlier. Right here. So this has like chicken and tomatoes and basil and some olives in it. So it's not, even if the volume of the food is 3 cups, there's probably like a cup and a half of pasta. And something, if we're thinking about portions and pasta, trying to maybe increase the veggies. So in this pasta plate, I would probably add in a whole bunch of grilled zucchini. I would probably roast those tomatoes to give them more sweet and pop. Maybe put some sun-dried tomatoes in as well. And put lots more veggies, maybe dice up some artichoke hearts. So I would really try to amp up the vegetables in this and take away some of the pasta, but still be less with like the 3 cups for the meal so that I stay full. So I think those are just kind of some different strategies to think about. And something, if you do like to eat pasta, just thinking about the 2 ounce dry, these are all the different types of pasta. And as you can see, cooked, it's all kind of different portions. And that really has to do with how compact that pasta can get when it's cooked, how airy it is, different things like that. And then 2 ounces of pasta like spaghetti or angel hair, if you think about the size of a quarter, what fits in the size of a quarter is about 2 ounces if you're trying to kind of make a single serving of dry pasta for yourself. I'm always a fan of cooking in bulk though, so we don't have to keep boiling water and work as hard. But if that's something that you like to do, about a quarter size is about that 1 cup. With a lot, if you ever use these spoons that can help cook pasta, that middle circle, if you put your spaghetti through it, that ends up being about 2 ounces as well, dried. Some other carb counting challenges that everyone always talks about is eating out, right? Thinking about when we eat out, we get a lot different types of foods than we might make at home. Oftentimes those foods are higher in fat, potentially higher in protein. And when we think about foods that are higher in fat, they actually can raise our blood sugar for higher for longer because it really slows down our gastric emptying. And there's this thing called hepatic glucose production. It's just a super fancy word for saying what is your liver doing? And your liver can put out blood sugar. So when we live with prediabetes or diabetes type 1 or type 2, our liver can put out extra sugar in our food. So normally what happens is if our bodies are putting out insulin for somebody who's living with prediabetes or type 2 diabetes, our body's putting out insulin. There's another hormone at our pancreas called glucagon. Glucagon is being suppressed, right? Because glucagon tells our body to put out sugar from our liver. And so they often work inversely of each other. And so what happens is sometimes when you're living with prediabetes or diabetes, sometimes you don't get that suppression. So you're getting more liver sugar. Fat can kind of make this happen a little bit longer, or protein, because we're getting digestion carbohydrates for longer. If you're somebody who's living with type 1 diabetes, this is definitely happening because we have the absence of the ability to put out insulin. So glucagon is always going out because there's no suppression at the pancreas level. And then with protein, we can get more of a liver sugar response. And so just something to kind of think about. So different foods that are higher fat, different fried foods, foods that are creamy or cheesy, a lot of meat-based foods, especially ones at restaurants. And most meals out at restaurants are a little bit higher fat. It's not to say that we shouldn't eat at restaurants, or I'm not recommending. I really enjoy going out to eat. I think it's a lot of fun. But thinking about that might have a little bit longer impact on blood sugar. So what can we do? So if we are going out for pizza or burgers and fries or Chinese food, can we get steamed veggies and have them on the side, eat them first? Can we get a side salad and start with that? Can we take home half of our portion of our pasta dish and enjoy it later? So really thinking about how do we alter the portions instead of completely abstain from going out. So getting back a little bit full circle, thinking about the grams versus glycemic. So hopefully I've been making a really great case that it is about the carbohydrate grams. It gives us a great structure and parameter, but really how glycemic a food, that it can have the same amount of grams, 30 grams and 30 grams, and it can affect our blood sugar differently. Foods that have more kind of a glycemic ability, things I always think about how processed it is, like those 7 things we talked about, like the process, ferment, things like that, sometimes need insulin in earlier. So if you're somebody taking insulin like 15 to 30 minutes, foods that are a little bit going to get in our body faster, like fruit or rice, pasta, bread, sweets. Some other things to think about too, if we're pre-bolusing or not, is what's your current blood sugar, and then what's your CGM arrow if you're wearing that. This is probably more for people who are living with type 1 diabetes, but I think it's important to know, like when we give our insulin, really can have a big impact. And then not all carbohydrates digest the same. And so if we're thinking about pre-bolusing, the ones on the left side, the lower glycemic foods, are foods that we need less of a pre-bolus for because they take a lot longer to digest. And so our bodies aren't going to raise blood sugar as much. So thinking about like for example, sourdough bread, fermented for greater than 24 hours, barley, bulgur, things that are whole grains, lentils, higher fiber, those berries, versus things like whole wheat bread. Even though the bread still has fiber in it, some of those fibers are kind of ground up and the flour is ground up. It's going to raise our blood sugar a little bit higher faster. And then moving over to things like cornflakes or white bread, even though cornflakes have no added sugar to them. They're just carbs. If you put a cornflake on your tongue, it's going to start tasting sweet very quickly because it's very digestible. So our bodies, for a lot of different kinds of cereal, are really able to digest them, and they can spike our blood sugar more. So this is kind of a research study I think is really interesting. So nutrient timing, does it make a difference? So they had this study, and they basically had people living with type 2 diabetes using a medication called metformin. It's an oral medication not known to cause low blood sugar. And so that was the patient population. They came into this study, and the first visit they had bread and juice, and they ate that in 10 minutes. And then they had a 10-minute break. And then they ate salad and chicken for 10 minutes. And so they had to finish all the food. It was part of the study. And then they measured blood sugar for 180 minutes. Then they came back again another day, and they had the salad and the chicken up front, ate that in 10 minutes, had a 10-minute break, and then had the same portion of juice and bread for those additional 10 minutes. And then the last time they got to come to the study, they got 3 meals, which is fun, from this study. They had almost like a sandwich. So the salad and the chicken and the bread, and then half the juice, and then 10-minute break, and then the rest of the sandwich. Although if you look at the sandwich, I think it was pretty heavy on the lettuce and the chicken, a little bit less heavy on the bread. So maybe not as realistic. So when we think about kind of which of these do we think raise our blood sugar the least for these people? What do we think? You can put it in the chat, and I can look at that. What do you all think? Yellow, blue, or green? What do we think? Or you can put it in the Q&A as well. What do you all think? Do we think that the yellow with the bread and the juice up front? Okay, someone
Oh,
saying blue.
we have a response. Someone said blue.
Okay, yeah, blue. Do we have anyone else? Oh, we have multiple blues.
Multiple blues.
Anyone think anything different? Are we all going to agree with blue? Okay, yeah, thank you both for responding. So when we think about what yielded the least amount of blood sugar post-meal, you're definitely right, blue. And so why is that? So the researchers, when I was asking about this, they didn't have a very firm reason, but there is this idea called the first phase response insulin. So when we're not living with prediabetes or diabetes, our bodies will start making and activating insulin from our pancreas as we chew and swallow our food, really having it in our bloodstream to be utilized and to help store food. And so when we live with prediabetes or type 2 diabetes, that first phase, and type 1 diabetes, first phase response insulin kind of dissipates. So it really goes down. And so when we put foods that are very glycemic in up front, we have a more robust blood sugar spike from that. So I always think about maybe sushi rice that has like vinegar, but sugar and sticky rice. If we eat that in first, versus eating maybe like a protein or like fish or some salad, then that's going to have a more apparent blood sugar rise versus somebody who's not living with prediabetes or type 2 diabetes. So in this case, by adding the non-starchy veg, the salad and the chicken, we're not really putting carbohydrates in the study for 20 minutes is the time that the carbohydrates are going in. So it's really allowing that first phase response insulin to be activated and to help us kind of meet the needs of the carbohydrates that we're consuming. So I do think that does this mean that we always have to have non-starchy veg and protein before every carb we eat? Absolutely not. But if we're thinking about going out to eat, maybe eating foods we're not used to or more pasta, for example, perhaps we do order that green salad and put some protein on it and not have croutons, and then enjoy our pasta and have a little bit of that delay and maybe some of this benefit. So kind of to wrap up, I do acknowledge carbohydrate counting can be really tricky. And the reason why I chose this topic to talk about is we've not ever done actually a wellness group really focused just on carbohydrate counting. So I really wanted to put some of that information out there. If you want more information, you can always get a referral to dietitians wherever you get your healthcare. Stanford Healthcare also has carbohydrate counting classes as well as like pre and classes for people living with diabetes and prediabetes. So there's a lot of education out there. But really think about as an experiment, maybe you want to portion out your carbohydrates and measure them for 3 days and say, oh, am I having a cup of rice or have I been having half a cup of rice? Because often when I meet with people, they'll say, oh, I just do like one rice scoop. But that's hard to quantify. And that could be like a scoop on days you're really hungry or a smaller scoop. So really trying to quantify what that looks like on your plate can be really helpful. And then noticing your blood sugar. So if you're wearing a continuous glucose monitor, what is your pre and post meal blood sugar? Is it raising more than 50 points within the hour and a half to 2 hours, or is it raising less than 50 points to kind of see? And then really know that different foods affect our blood sugar differently. And perhaps for you, having beans or lentils mixed into your rice is something that makes that rice less glycemic if you enjoy rice. So trying to figure out ways to kind of adapt and make changes while still enjoying your foods. And then there are times and seasons, like I started this talk, that you may focus more on carb counting and really dialing in and looking at portions. Perhaps you're a caregiving for someone who really needs to carb count and dose insulin, or you really want to dial in your portions. You have a spring break or some bandwidth, then that's a great opportunity. But are we always going to be so detail oriented? I would just say that's probably a recipe to get a little bit burnt out. So we want to think about what season is it? Is this a really detailed season or less? And then definitely working with a dietitian, diabetes educator if there are foods that are really have been tricky for you. And so with that, I'm happy to take questions.
Thank you so much, Leah. Thank you for the wealth of information on the carb and carb counting. I actually learned a lot too, especially with the effect of temperature on your blood sugars. And so I know also probably the audience really enjoyed that you spent some time going over the carbs and pasta. Um, we have a little bit of time right now to answer a few questions from the audience. Some of the questions came in a little bit earlier, and I think you went over it a little bit, but I could still ask the question regarding keto bread and sourdough bread, and if that's okay for type 2 diabetes and how it affects the blood sugars.
Yeah, that's a great question. So there are a lot of products out that say like keto or keto friendly. They really just mean lower available carbohydrate. So they get to that label. It's actually not a regulated label, so people can just kind of put it on whichever type of bread that they want. Oftentimes it's higher fiber. So sometimes they'll add supplements like inulin or different soluble fibers to kind of instead of flour to kind of get that mouthfeel and texture. Sometimes those breads are a little bit more crumbly, better toasted than untoasted. But looking at, I mean, that would be a fine option. There's a lot of different options if you want a lower carb bread. But if you're not having bread every day, maybe you just want your favorite artisan piece of loaf. But if you're eating bread every day and you want to think about lowering blood sugar, perhaps you look at a lower carb, higher fiber option. And then you want to think about all this in the whole landscape of everything. So are you also watching your lipids, for example? Maybe this keto bread has a lot more fat than a regular slice of bread, like a sprouted wheat bread. And so maybe you're looking to amp up your fiber, for example, from natural sources. You go more that sprouted wheat bread versus keto. So it's totally up to you, but I would say a lot of the keto breads are a little bit higher fat, but would have lower carbohydrate availability.
Thank you. We also have another question coming in regarding, I guess, more about sustainability, being realistic about compliance with monitoring your blood sugar. So, would you recommend carb counting versus a Mediterranean style diet? Which one do you think has a better compliance for long term?
Yeah, that's such a good question. So I think it's really, I would put that question back on that person asking it. Do you want to eat more of a Mediterranean diet as it's been studied, which is a diet that has lots of monounsaturated fatty acids, lots of produce, fruits and veggies, whole grains, lentils, legumes, things like that. Um, less processed foods, or do you want to think about carbohydrate counting? When I think about Mediterranean diet, I also think about overall metabolic health. So if we're kind of people are flagging your blood pressure and your lipids as well as blood sugar, then maybe Mediterranean diet, they have a lot of great research around that. And then maybe if you're somebody like me, I mean, I like a lot of Mediterranean diet type of foods, but I eat a lot of different varieties. So I don't like to just put someone into like a diet category. But what can we glean from the Mediterranean diet? How do we add more produce to our meal? I think is a great first step. Carb counting, I would say, is the more numbers and it can be a little bit more arduous if we're not dosing based on what we're eating, insulin. Then I would say we have the full array of options. We could eat just focusing on a goal setting, like adding in a cup more of veggies at dinner. It could be more looking at Mediterranean diet options. It could just be more going back to the foods that we like to eat, cultural foods, for example, and really saying, like, what do those look like and how do those, like the more veggie based options, I think could be a great um, place to start too. And so I don't actually put people specifically on a Mediterranean diet often, but really explore what types of foods that they like to do and how can we kind of glean and add more fiber and think about what aligns with what their labs are telling us.
Thank you, Leah. And last question before we wrap up. Someone mentioned if you could just go over again one last time about the temperature, about the hot and cold and how it relates to your blood sugars.
Yeah, so hot foods can get into your bloodstream faster and raise your blood sugar faster. For example, like a hot chocolate versus like a cold, icy chocolate. Same grams of carbohydrate, the hot chocolate will raise your blood sugar higher faster. Oftentimes, once our blood sugar, if a food's more glycemic, which just basically means it's getting into our bloodstream faster, um, it makes it harder for our bodies to take that sugar and bring it down because oftentimes we've lost our first phase response insulin. So what happens is our we have hot chocolate and our blood sugar is raised. And we're like, what? I only had 30 grams or 15 grams of carbohydrate, but the yield of the raise of blood sugar is higher than what I would have expected. That's because it was probably a hotter food and the body was less able to kind of meet those needs. Um, does that make sense?
Yeah, no, I think that was really helpful.
Oh, I also saw one other thing that popped in about resistant starches. I think somebody asking about kind of refrigerated pasta, refrigerated rice. It's actually really interesting. So this, I think, was in maybe the Washington Post or something. They did an article on it maybe 6 months ago. I actually saw research that looked at this and the available starch and resistant starches that were converted from refrigerated rice and pasta probably 10 years ago. But I think it's just maybe new people have picked it up and looked at it more. It does convert some to resistant starches, and sometimes even converts a little bit better if we add a fat as we cool it down. And for some people, it makes a notable difference on blood sugars, and for some people, it doesn't. So I would just, if you have a continuous glucose monitor, see. I wouldn't go so far as to take refrigerated rice and decrease the gram of carb that we count for it. I would only do that if you start seeing low blood sugars within that like 4 hours post delivering insulin. But I do think it may get in a little bit slower with those resistant starches because our body doesn't digest it. And so that can be really helpful in letting our bodies sort of meet the needs of the carbohydrates. Yeah, that's a really good question.
Yeah, no, thanks so much, Aaliyah. What a fun topic and such great questions that the audience asked. I so appreciate your time. Someone just says, thank you, Leah. You're awesome. And you have some super fans out there. So thanks so much. And if you are interested, you can join us again next month at the same time for our cooking demo on June 13th with our chef, Chef Ryan Fredericks, and our own Leah Groppo. So, um, Hope to see you guys again next month. Thank you so much. This class was being recorded, so you'll be able to see and view this presentation again next time.
Thank you all.
Thank
I
you.
really appreciate your time. It's such an honor. Bye.
Bye.